If you or someone you know has been told they need an ERCP, you might be thinking, what on earth is that? Well, it's not exactly a household term, but it's one of the most useful and fascinating procedures in gastroenterology. So today, I want to walk you through what an ERCP is, when and why we use it, what happens during the procedure, and what you can expect before and after. We'll keep it straightforward, medically accurate, and I'll even try to make it slightly entertaining. Let's get into it. So what is an ERCP? ERCP stands for Endoscopic Retrograde Cholangiopancreatography. I know, not the easiest phrase to say over a coffee, but the name essentially describes the procedure. It's a specialized endoscopic method we use to examine and treat problems in the bile ducts, pancreatic duct, and gallbladder. Think of an ERCP as a combination of endoscopy and X-ray, a kind of high-tech plumbing job for your digestive system. We pass a flexible tube with a camera called the duodenoscope through your mouth, down the esophagus, through the stomach, and into the first part of the small bowel called the duodenum. That's where bile and pancreatic ducts drain into. Using this approach, we can access the ampulla of vata with a catheter, inject contrast dye into the ducts, and use real-time X-rays to see what's going on. And here's the cool part. ERCP is the one endoscopic procedure that is mainly therapeutic. That means if someone is getting an ERCP, we are almost always aiming to fix a problem. Why would someone need an ERCP? We use ERCP when there's a suspected or known problem in the bile or pancreatic ducts that needs intervention. Common reasons include gallstones in the bile duct. Sometimes gallstones can escape the gallbladder and lodge in the common bile duct. This can cause pain, jaundice, or even serious life-threatening conditions like bacterial cholangitis. ERCP lets us remove those stones without the need for surgery. Bile duct strictures or blockages. These can occur from inflammation, surgery, trauma, or even cancers. If a bile duct is narrowed or blocked, we can insert a stent to open it up and allow bile to flow again. Pancreatic problems. We may perform ERCP to manage chronic pancreatitis, pancreatic duct stones, or evaluate suspicious narrowing of the pancreatic duct. We can also investigate unexplained jaundice. When blood tests or imaging shows elevated liver enzymes or bile duct dilatation, ERCP can help us find and fix the cause. So what happens during the procedure? Let's talk about what to expect if you're having an ERCP. First, it's done in hospital, usually as a day procedure, and you'll be sedated or under general anesthetic. Depending on the case and hospital policy, you'll be lying on your side or on your tummy, and the endoscope goes in through the mouth. You won't feel pain, and you won't remember most of it. Once we reach the duodenum, we find the ampulla, insert a tiny catheter, and inject contrast dye into the bile and pancreatic ducts. This lets us see their shape and any blockages on X-ray fluoroscopy. From there, depending on what we find, we may perform a sphincterotomy. That's where we cut a small muscle to allow stones or bile to pass more easily. Remove gallstones, place a plastic or metal stent to open up a narrow duct, or take biopsy from suspicious areas. The whole procedure usually takes 30 to 60 minutes, and sometimes longer if it's complex. Well, what about the risks? Now, like any medical procedure, ERCP does carry some risks, although serious complications are relatively rare. The most common risk is pancreatitis, and that's inflammation of the pancreas, which can happen in about 3 to 10% of cases, depending on your individual risk factors. In most people, it's mild and settles with a short hospital stay. Other possible risks include bleeding, especially if a cut or sphincterotomy is made, infection, such as cholangitis if a duct remains blocked, or perforation, a tear in the bowel wall, which is rare. Other times, you could have a reaction to the sedation. We take every precaution to reduce these risks. We may give antibiotics, place temporary stents, and use medications to lower the risk of pancreatitis. Before the procedure, you'll have a chance to go through everything in detail with your gastroenterologist or anesthetist. What should you do before and after an ERCP? Before the ERCP, you'd usually be asked to fast for 6 to 8 hours, which means no food or drink. Let your doctor know if you're on any blood thinners, diabetic medications, or have any allergies, especially to contrast dye, iodine, or seafood. You may need to stop certain medications a few days before the procedure. This will be discussed with you beforehand. After an ERCP, you'll be monitored in recovery while the sedation wears off. Most people go home the same day, but if the procedure was complex or if you're at a higher risk of complications, you may have to stay overnight. You may feel bloated or have a sore throat, and that's normal and usually short-lived. If you have a stent placed, we'll discuss follow-up to remove or replace it later. If you get severe pain, vomiting, fever, or feel unwell, you should seek medical attention straight away. Final thoughts. So, to recap, ERCP is a highly specialized, minimally invasive procedure we use to diagnose and treat problems in the bile and pancreatic duct. It is often used to remove bile duct stones, relieve obstructions, place stents, or take tissue samples. It's safe, effective, and avoids the need for open surgery in many cases, but like any procedure, it carries some risks which we take very seriously. If you've been told you need an ERCP, it's completely normal to feel nervous, but remember, you'll be well looked after by a trained team and will always explain the risks and benefits for your specific situation. As always, if you've got any symptoms like jaundice, upper abdominal pain, or abnormal liver tests, talk to your GP early. We have lots of tools like MRCP, EUS, and ERCP to investigate and treat these issues before they become more serious. Thanks for watching. If you found this helpful, please like or share it and subscribe for more clear, practical info on all things gut health.